So happy everyone is here. This is really great. I'm Laura Perryman in Seattle, Washington. I'm a board-certified ophthalmologist and cornea refractive fellowship-trained ocular surface disease enthusiast. And this is so amazing to be here with my dear, brilliant friend, Dr. Doug DeVries. He is out of Reno, Nevada, and a brilliant mind, not only scientifically, but also as a businessman. So I love the perspective that you bring to this. And why are we here today?
Laura, we're here to talk about really a type of shift that's happening and driving more procedures into the offices, and really some innovative treatment that we're able to provide. And I've been providing for about 5 years within my practice.
You had me at innovation. Right? We love innovation, and I agree with you. So as clinicians, seeing these patients all the time over the course of their lifetime, what is your impression of just how common dry eye is in any given day? Tell me what you observe.
Well, and when you look at the studies like the Trattler study that shows that cataract patients, for instance, that are being referred in, that almost 81% of those patients are level 2, 3, or 4 dry eye. And that certainly is mimicked and duplicated within my practice. And I would say it's probably, if anything, a little understated that we see, because we really haven't defined some of the symptoms. And I think we exclude people that have fluctuation in vision. So it really is such an immense patient pool that we could be looking at. And I feel that as we're treating our patients, to be able to offer them faster remediation of their condition. And when I look at ocular surface disease, I really look at it, we talk about aqueous deficiency, we talk about whether it's evaporative, and really I look at patients along a continuum, that they're at some point on that continuum where this is going to manifest, where they're going to have MGD. And the reason I say that, Laura, is when you take a look at your Sjogren's patients, have you ever seen a Sjogren's patient with good meibomian glands?
Nope.
And that is the consummate aqueous deficient patient, right?
Classically, yes. So
Yeah.
do you even split aqueous and evaporative anymore in your mind, or are you focused
No.
on breaking that vicious circle?
I am just looking at what is going to break that vicious circle of inflammation.
Yeah.
What can we do in a shorter period of time to get some type of relief for that patient?
That's right. And so you and I trained in a day where we had plugs and artificial tears. And how many patients did that leave behind? How many of those patients needed more?
It left so many patients behind. And it's interesting because, we had patients that we put plugs in because that's all we had. And it worked on a lot of patients, but a lot of patients it didn't work on. And in my mind, I justify it by saying, well, it's the apposition of the plug, it's the discomfort. No, we were plugging up inflamed tears.
Creating frog ponds. You got to clean up the water first and then stop the outflow. Super awesome. So this idea of inflammation, this idea of dry eye being an inflammation-based disease, has made both of us, in lots of awesome discussions we've had together over the years, has made both of us active hunters and active searchers for innovation for our patients.
Yeah, absolutely. And I think that whether we're looking at immunomodulators, whether we're looking at doing lid procedures, where we're looking at something innovative as IPL and OptiLight, you just seek out what can help the patient. Regardless of what it is, we're always in that quest because we have patients that are difficult.
Yes, and challenging, and have complex situations where you really do need to reach for more tools. And now we've got one. So, but this is not a cowboy thing at all. I grew up in the wilds of Montana, raised by wolves, so if I accidentally swear, that's why. Sorry. But this is not a cowboy thing. This has deep roots in clinical science, right? This has been around since first described in 2005 using IPL
Right.
for dry eye and MGD and ocular rosacea. It was our buddy Rolando Toyos
Yes.
who first described it and first noticed the connection, because he was a keen observer and he was trying to help his tough cases, his tough patients.
And he discovered it accidentally.
Yeah, just by being a keen observer.
Yeah, it was
right?
yeah, it was one of those things that, hey, these patients that are having IPL, their dry eye is getting better, but they were having IPL with his wife, also a physician, and oculoplastics that was doing aesthetic procedures. So it really was a serendipitous discovery to say, let's figure out why that's helping.
Right. And then, so now that you've got this basis, since 2005 when it was first described, and you add on all this abundant scientific literature describing the benefits of IPL, and the vast majority of it is off of the luminous technology, right? You see across the board, again and again, across all these different studies, consistent improvements in what kinds of things for the dry eye patient?
Well, what we see is a consistent decrease in inflammation, a decrease in symptoms, improvement, and that's before you even throw in the cosmetic benefit that's happening with those patients.
Gift with purchase.
And
right?
And it is. I mean, those patients, and I'll tell you, I'll take patients those patients that can't tolerate medications, they don't do well with supplements, they don't do well at all. We limit the choice, and now we go to mechanical procedures, and doing something like OptiLight, we're seeing, and they'll say, this has been the only thing, A, I can tolerate, B, that will improve me.
Yeah, no, I love that. I describe it to patients like this is a big push in the right direction, and everything else we do after this will just work better. Don't you love not having to write a prior authorization?
Yeah. People ask me all the time, does it have reimbursement? And I said, oh, no, thank God, no.
Yeah,
do we want to see it? No, we don't want to see reimbursement.
No, we don't. This becomes a direct care modality that you actively do with your hands, not on a keyboard, but you're actively doing with your hands to address your patient's inflammation around their dry eye and MGD.
And one of the misnomers that has occurred is, and I actually was guilty of this when it first started out, is I thought that perhaps adding IPL and really addressing the inflammation in the lids would cannibalize my thermal pulsation, which I did a lot of. And what I found is actually when you're reducing the inflammation on the lid margins and then removing the obstruction, it doubled the amount of thermal pulsation I've been doing. And that's been consistent. It started out and I thought, well, this is an aberration. Well, 5 years later, it's not an aberration.
Right. And the synergy, I love that description. The synergy of these modalities are enhanced when you take the time to address the inflammatory burden first. No, that's super awesome. It's fast, it's effective, it's efficient. Do you remember back in the day when you would have, a rosacea MGD dry eye patient, you'd be like, okay, here's your doxy, here's your warm compress, here's your topical medications. And that rare patient who was perfectly adherent with everything that you recommended,
you had one of those?
they get better. Yeah, right. The perfectly adherent patient. It's as common as hen's teeth, would you say? Yes. But this becomes a way to help your patient with adherence to therapy challenges. We have discovered that it's a way to minimize your patient's polypharmacy, need for secondary, tertiary medications, which also saves the staff time in dealing with the insurance company rigmarole and skullduggery of prior authorizations. How do we get here anyway? Sidebar discussion.
Yeah. And as we look at the operational efficiency and actually monetizing your chair time, I mean, it's all about efficiency. And I think the pandemic has really showed us how you have to improve efficiency and what you can do. And I think adding those procedures in and doing more procedure time, because my amount of time that I actually spend doing the OptiLight is very, very minimal. Because my staff can get them ready. I can walk in, I can do the procedure.
So good.
I can be out.
I love that. I love that. So sort of like calf roping for time. What's your best OptiLight in room?
Oh, yeah.
First pulse to last pulse.
I will tell you that when my technician has that patient set up, they have the covers on, they have the coupling gel on. At that particular time, I mean, I'll be in there and it'll be 2.5, 3 minutes.
Sounds about right. It's pretty awesome. No,
Yeah.
I love it. It's such an easy to follow protocol, and it benefits your patients and it benefits your practice. And it changes the approach to dry to much more of a procedure-based modality.
And when we take a look, and Laura had mentioned that, and I don't know if you mentioned that, my undergraduate degree was in financial management and in finance. And so I tend to look at things both from the standpoint of what can I do to help my patients, and what is that going to have impact is that going to have on my practice. And what I've found out is this is probably the fastest payback of any piece of equipment I've ever purchased and ever implemented. Because sometimes you get off to a fast start on something, another type of technology, but this is one of these modalities that if you are getting ready to implement OptiLight into your practice and you start telling patients, and on that training day you have 15 to 20 patients that are ready, two things happen. First of all, you retire about a quarter of the debt the first day.
Nice.
Second of all, what happens is now you're comfortable. You've been mentored. You've had somebody watching you. You're doing different types of skin types. And your confidence, and then you're really ready to roll. So I would really encourage, if you look at this technology and you implement it into your practice, start lining up patients and get those patients that are going to be paying for it, your staff members, get that experience so you don't have any downtime afterwards, and you start. And when we talk about the instrumentation, and is it portable? Yeah, it is. And people have said, well, could you share an instrument, and do you ever share your IPL? And Laura, I think we're doing that dinner when I said, no, I don't loan anybody my ATM machine.
That's awesome. And I love your financial rigor, your acumen, because and this is something that as a clinician, scientist, and poet, I'm like, huh, what numbers? Like, it's just like, so I'm always envious of his skill set. But that's exactly it. You turn it into something that becomes a drain. Does anybody here raise your hand if you think that dry eye takes too much time to educate and discuss? Anybody? Yeah. Would you like to save time? Yeah. Would you like to waste less time and actually turn that wasted time into profit, into a money-making thing? Would you like that? This is your ticket. This is your golden ticket.
And I always evaluate any type of technology as what value is it going to bring to the patient? And then
that's
what
the
impact
key
is,
part, right?
It is. I mean,
it's all about that. It has to be centered on
increasing the level of care has to benefit that patient. Not just doing something to do it, but doing something that is going to make that patient healthier. And then you evaluate, what is it going to do for my the finance of the practice? What is it going to do? So if I can increase care, if I can give better care, and it works out well as a modality for the practice, then I know I'm on technology. And then it comes into integrating it into your patient flow.
I love that. It's the trifecta, right? Patient care first, access second, and integration of care third, right? Like and health to the practice, health to the patient, health to the practice, health to you and your staff by less wasted time, more efficient delivery of care, and even in happier patient outcomes. There's a high amount of patient awareness around IPL, so it's and particularly OptiLight, so you don't really have to do a lot of talking about it. Patients are already aware of what IPL is, and OptiLight is the FDA-approved method for giving that care for dry eye and MGD.
And that really changes things.
Yes.
Having the FDA approval on a device, and it is from the leaders who created IPL.
All right, awesome. And with that, Doug, it's always nice to chat with you. Thank you so much. I always
absolutely
learn a ton from you. So thank you so much for being up here today. I really appreciate it. And
okay.
Text me later.
All right.
Yeah, let's catch up on other stuff.
Alrighty. And
awesome.
Continue on.
Okay, thank you. So thank you so much, Dr. DeVries. I'm going to brag about him for just a sec. The man is brilliant, and he's just a really sweet human on top of it. So really, really appreciate him. Let's talk a little bit about... we don't need to get the slides back up. Anyway, let's talk a little bit about the specifics of what's going on. We talked a little bit about earlier about not separating out aqueous deficiency from evaporative so much anymore. It's really about inflammation at the epicenter. That's a sensitive word on the West Coast, right? The inflammation is absolutely at the epicenter of dry and MGD, and it drives both of them. And so having an effective FDA-approved way of addressing inflammation is where the magic is. But there's a little bit more to this story. We know that with meibomian gland dysfunction that there are 6 interrelated mechanisms of MGD. And I call that the besto of MGD. Roar, right? So imagine Jabba the Hutt. He's laughing at your warm, wet washcloth, okay? So that's not going to cut it. We have to address all 6 heads of the besto. Bugs, bacteria, Demodex. E is enzymes. I is inflammation. Amazing peer-reviewed papers demonstrating the reductions in inflammation associated with dry disease and MGD. S is stasis or constipation. Do you have a meibomographer and you show your patient how abnormal their meibomian glands look compared to the normal poster? Patients want to do something about it. Doc, can I get them back? We can sure make them healthier. Sometimes we can wake them up, but this is the best way to get there. T is altered melting temperature. That's why we prescribe heated masks, in-office thermal pulsation modalities, like Dr. DeVries mentioned. And then finally, there's obstruction. And so having a tool that addresses all 6 heads of the besto is key to helping give that patient a big push in the right direction. And that's what you get with IPL. It's less of a thermal modality, which is why we still layer on our in-office thermal expression modalities. But you really get a huge crack at the besto with IPL. FDA approval is a big deal. This puts the power of excellent science and FDA approval behind your adaptation of this in clinic. This is the only IPL system that has FDA approval. What makes it special? What makes it special is the technology behind it, the software behind it. The ease of use of this thing is absolutely remarkable. So with the FDA approval, you're able to clearly treat on label to improve the signs and symptoms of dry disease associated with meibomian gland dysfunction and create a lot of control of the whole local regional problem. Most patients don't complain too much about the aesthetic benefit. I call that the Dow to healthy, beautiful eyes. D-A-O. Dermatologic, aesthetic, ophthalmologic overlaps to healthy, beautiful eyes. This is the greatest way to get them there. So the FDA approval is a big deal because check this out. I want to show you a little buttonology here. This is so simple and easy to use. Is anybody intimidated by this? Is this a little scary to you? That's okay. It'll quickly become your very best friend. It's so easy to use. I just pushed a button. It's going to start warming up. It has these amazing filters on the inside. You're going to pick the rosacea appropriate skin type filter. There's only 3 filters you have to worry about with the basic system. It's made a lot of that extra thinking. It's taken out of the equation, so that helps you in the course of a busy clinic. It's just so easy to use. This one's already preloaded with rosacea 1 through 3. We'll talk about skin typing. It's basically the melanocytes that you're born with. And so ask a patient about their heritage, their family background, recent sun exposures, do they tan well, and how long do they hang on to a tan. Those things will help you accurately Fitzpatrick skin type. And if you're not sure, you can always be more conservative and still get a great result. Ask them when they come in for their follow-up treatment. How'd your skin do? Oh, great. I mean, I felt a little pink and flushed for about 15 minutes, and then I was fine. Great, let's bump you up as Fitzpatrick skin type. Or we're coming into summer solstice. The sun doesn't shine in Seattle, right? It's where the sun doesn't shine. And there's always this week of sunny weather in April, and everybody loses their mind. They go outside, they're like, what is this orange thing in the sky? They get so excited and they forget about their sunscreen. So I got to back off during times like that. Patient who's come from vacation, etc. Okay, so here we go. I can't fire this on stage because we don't have eye protection for everybody, but I would have my goggles in, my patient's reclined. I do this with 2 hands, so I'm going to struggle here a little bit. Patient's reclined, they've got gel in their face, their eyes are protected. Their eyes are protected. Did I mention how important that protected the eyes is? It's very important. Protect the patient's eyes, protect your eyes with the goggles. Then I'm going to come along and simply apply the light energy in an overlapping fashion, about 10% overlap from cheek to cheek, right? That's it. Do it twice. Great. Done with part 1. Part 2 is simply change to the other handpiece, and I don't have my other hand, so I'm just going to show you what this is. All you have to do is change out the filter to OPT. That tells the machine that's what we're doing. Changes the software. wake up this little handpiece. We had a hand in designing this. So cool. It's like so user-friendly. You just wake it up and you apply the light energy. Imagine there's stickers on my eyes. You apply the light energy right underneath the stickers in a double pass. Make sure you get this little area right here. I call that the money shot. There seems to be a neural stimulation effect by putting IPL energy right in here from my clinical experience. And do the other side, about 10% overlap. Do it again. And here we go. This is so comfortable for patients. This tip allows me exceptionally elegant precision of application of the light energy. You can treat inflammatory lesions with this as well. This is off-label, but you can go right over the top of a chalazion and get it to melt away without surgery, without injections, without prior authorization shenaniganery. We have an IRB-approved study that we're in the middle of looking at this modality for the treatment of styes and chalazia. Does that interest you to not have to send them to your ophthalmologist for injection or incision and drainage? Do you think patients appreciate not having a needle stuck in their eyelid and a scalpel applied to their eyelid? Yeah, they really appreciate it. Dread-free, drop-free, light-based therapy. I think that's sort of it for the technology here. I have booth time set up later today and then again on Friday afternoon. So I'm happy to show you some more of the buttonology, but don't be afraid of this thing. This will quickly become your best friend, your little R2-D2 unit right here, right? Awesome. So with that, I am going to invite my colleague up on stage. Dr. Jennifer Tsai is the founder of a specialty boutique eye clinic in New York City. And remind me the name of your awesome clinic again? Line of Sight. So I'm going to brag about you for just a second. So she's an entrepreneur, she's a doctor, she's a businesswoman, and she's really a nice human on top of it. So I love your stuff. So she founded Line of Sight. It's a boutique integrated eye wellness center. They do dry eye management, they do myopia control, and it's aesthetics as well. She's also been named to the Forbes 1000 Rising Stars, right? That's a big deal, you guys. Super cool. And she's the founder of her own eyewear company, Carrot, right? Super cute. So, welcome to the stage. Oh, and you have to follow her on Instagram, you guys. Dr. Jen and Juice. She's got the coolest, like 300,000 followers, 350,000, something like that.
Not quite there yet.
Oh, well, it won't be long.
Combined.
Nice. And I'm putzing along with my little 3,800. But anyway, it's super fun. I'm so glad you're here. Thanks for coming up.
Yes, thanks for having me. And I always love coming to talk with you because I always learn so much from you too. So,
well, that's what makes dry eye fun. We all learn from each other, right? Right. So you were the first optometrist in the United States to integrate OptiLight into your clinical practice, and I got to meet this amazing lady at Vision Expo East in Orlando, and we had this awesome conversation, and that's when she signed on the line. She's like, yeah, I'm doing this, and I'm dying to hear what your experience has been since you brought it into the clinic.
Yeah. So, I mean, I think a lot of people might be able to relate, especially since this is a brand new device that came out this year that got FDA approved. And if I were to tell the complete truth, I was absolutely nervous. I was like, am I going to be able, especially as a new practice, convert these patients who are, mind you, all in for brand new comprehensive exams to a device like OptiLight to do dry eye treatment? And to my surprise, it's something that they actually prefer over other alternative options. And I think learning through the process, it has more to do with the fact that a lot of patients are looking for something that gets to the root of the issue that they're dealing with. And I think the younger generation of the population are more into their health and their wellness than we think of. And so they want to take a proactive approach to sort of prevent dry eyes because they deal with it with all the computer time and screen time that they get.
Yeah, that's awesome. And that makes such great sense because you've got this beautiful boutique practice, high fashion, like high care, high touch, all that stuff, focused on wellness. And you find the conversation around IPL, OptiLight specifically, and wellness is an easy idea to convey, and patients adapt to it.
Right.
Yeah.
So for me, I mean, I think I always start the conversation. It's an open conversation about, how do your eyes feel lately? Do you spend a lot of time on screens? How do you feel tired at the end of the day? And they mention themselves that they deal with dry eyes. They wear their contacts all day long. They look at screens more than they did ever in the past. And I kind of just educate them about how IPL works. They've never heard of it before. And, similar to when you go into the dermatology office, when they treat your skin, there's a aesthetic side to this, but there's also a dry eye clinical approach to it that treats it. And it helps to target the inflammatory process, which is a cycle, and it kills bacteria, and it helps with my meibomian glands. And after I explain that, what sticks with me is most of the patients say, that makes sense.
Nice.
Yeah.
Oh, I'm so excited. And then it makes sense to them of why, why the other things that they've tried haven't quite gotten them to where they want to be. And I love the idea that you're catching this so early in patient care. At some point, the dry MGD patient did not have dry eye and MGD, right? Imagine showing up at the dentist's office, never having gone to the dentist before, and you're like full of plaque, like my poor little dog. And you need your teeth pulled, right? I mean, there were so many steps of failure all along the way that could have been caught and prevented and treated. Imagine if it's high blood pressure, diabetes. What if we waited until glaucoma was a 0.95 cup, right?
Right.
So catching this early.
Yeah.
And patients are open to that.
They are. And I, again, with the conversation, I really start with education first. And I sort of display all the options that they have for dry eye treatments. I talk about, there's collagen plugs that you can consider. It is considered a more short-term relief, maybe lasts about 3 months or so. You could consider a thermal expression, but it doesn't stop the inflammatory process. Then there's IPL, which actually helps with all of that with a sort of longer-lasting impact. And 9 times out of 10, they end up choosing the IPL because of that.
Oh, that's awesome. And in your clinical experience, have you found there's synergy between all that other stuff that you offer, including in-office thermal expression and IPL?
Yeah, so it ties in really nicely together because when patients come in, if they deal with, for example, blepharitis and dry eyes, we say we kind of want to just clean the outside first before we clean the inside. It's like doing a outer deep cleaning and doing like a facial to remove like buildup and clogging of your pores, right? It's a similar concept. Bacteria can build up anywhere along with sweat and makeup, and in the long run that causes dry eyes, and they understand how that works, and it makes sense to them to sort of do the outer cleaning and then also IPL at the same time. Yeah.
I love that. And we go to the dentist twice a year, right? Mm-hmm. And it always feels so great, but you have to maintain the effect at home with the other things you're doing. And sometimes I'll joke with patients, only brush and floss the teeth you want to keep. only use OptiLight and our other modalities for the meibomian glands you'd like to keep. It just creates a shortcut for communicating things to patients. We use a lot of humor in our clinic. No, that's super awesome. Now, you got your system, you got your training. How many a day are you treating right now, and what do you see the potential growth as a businesswoman?
Yeah. So I saw a lot of potential, so that's why I wanted to bring into the practice in the first place. With Line of Sight, we offer more of a concierge personalized service, everything from when you walk in the door to when you leave, and we focus on new technology. And so IPL and the OptiLight tied right into sort of our what we were focused on. And so when we brought it in, I educated them first because they were all new patients. We started that process very early on. And after educating them, I provide them with information, and they sign up basically for a follow-up for the first treatment right after, so their second visit. And so after sort of getting the machine maybe end of June, it's been 3 months now, I average about two new sign-ons per day, but an average of 3 to 4 IPL treatments per day.
Awesome.
Yeah.
And that's amazing. And that's right about what I would expect. So I started off my career working for a family friend who was an optometrist in Redmond. While my kids were little, I was working part-time. And so family care, family eye care situation, and I would have these patients would come in for their routine exams, their checks, whatever, and rip-roaring dry eye. I was like, oh my gosh, it's everywhere. And so when I brought mine on, mind you, I was only working 1 day a week, medical cornea, like hitting it hard, doing general eye care as well. I'd still fit contact lenses. I would do about 3 to 4, sometimes 5 in the course of the day, just like a duck in, duck out, sort of easy procedure. And I found that everything else I was doing for my dry eye patients worked better. Patient satisfaction is, when we poll our patients, around a 9.5 in modality. And I challenge you to find that kind of satisfaction with any kind of prescription eye drop. What's your satisfaction rate?
They are extremely satisfied, and some of them have tried every treatment possible, and some of them it's their first time getting dry eye treatments. But for me, I love seeing the results. That's just me as a person, but also being able to show patients the results after each session and how it builds up. It really they see a difference over time, and it's gradual, but it's also very impactful for them.
Absolutely. And have you observed patients reporting back that their contact lens tolerability has improved?
Yeah.
Yeah, sometimes pretty quick, right?
Yep. So they notice that they're able to wear their contacts a little bit longer, and they notice that they also don't think about their eyes. And I say, if you're not thinking about your eyes, that means it's working. Yeah.
That makes me so happy to hear that. You shouldn't be constantly aware of your eyeballs. They feel like sandpaper, or they're burning and stinging and gritty and all that stuff. A healthy eye shouldn't feel like that. And we're restoring that for patients, which is super awesome. So walk me through the treatment protocol. How many sessions do you do, and how far apart do you place the sessions?
So the first initial consultation is to really educate them about the whole process. I give them takeaway information to read about pre and post care, and so that they are prepped when they come in for their initial treatment. So the treatment itself doesn't take very long. I have a technician that helps me prep the patient, take photos, put on gel, and when I come in, it really takes about 5 minutes to 10 minutes. A lot of the time it's just me mostly talking to them, asking about what they're doing this weekend, what their plans are. It's very easy and there's no downtime. So you could go in and out really quickly between patients within the span of an hour.
Oh, that's fantastic. And you said a couple of things that really resonated with me. Patients want time with you. There's this ancient idea in medicine of the laying of the hands, right? They want that time with you, and to be able to apply this effective modality in a brief period of time feels like incredible value added to the patient who's getting that time with you with this very effective modality. How often do your patients say that they feel better right after a procedure?
They say that right after. And I'm surprised because I'm like, I just put gel on your face. I just also did an expression, and then they're like, I feel great. I'm like, well, that's great.
That's super awesome. Now, over the course of the FDA-approved protocol is every 2 to 4 weeks for 4 sessions. And that's what's followed by expression. So you're supposed to do an expression afterwards. I actually don't do expression all that often. I find that the quality of the meibum improves over time as the inflammation comes under control and we control the besto, right? But yeah, the official FDA protocol is every 2 to 4 weeks for 4 sessions. Each session is followed by manual meibomian gland expression. How much fun. So we've got our slit lamp connected to a video screen. And I love it when my technician's in the room with me and I push on the meibomian glands and there's clear oil. Like, she can't help herself. She's like, oh, look at those oils. Right? It's like so much fun. It's so satisfying to see that normalization of a healthy meibum.
Yeah, and I actually do imaging, and I record on video for the patient to see the first time. And I show them after the 4th session what happens and what changes, and they're absolutely shocked. Yes. They're like, I can't even look at my own, this looks like Dr. Pimple Popper, what they see on videos. It's nice to show them sort of that visible effect too, what you're actually removing from their own glands.
Nice. And so let's say we have somebody who their disease has been cooking along for a long time, and they have a more severe case. What do you do in that situation?
So we do the 4 sessions, and then I have a discussion with the patient after the 4th session. Going forward, let's see how you look like in about a month, and then from that point forward, we can decide: are we going to increase the frequency to every 2 to 3 months, sort of as a maintenance? I had a patient who came in for his first time treatment ever, and he did not know he had dry eyes. He just thought that he had allergies. He thought it was allergies.
Oh, that's common, right?
He had allergies. His eyes were, he didn't know his bottom lids, it was just puffy. He thought they were just naturally bags over the years. And so we treated him for it. He had really severe meibomian gland dysfunction. And after the third treatment, he came in. He said, I just saw my parents. Haven't seen them since a year since the pandemic started. And they almost didn't recognize me. They thought I lost a lot of weight and that I got younger. They said, you look younger. Like, what changed? And he said it was all from just doing the IPL to clean up the lid. His puffiness improved.
Amazing.
Yeah.
Sort of like being bloated after a big beer and pizza night.
Right.
Yeah. It's like you got to clear all that out. Oh my gosh, that's such good news.
Yeah.
And I love that. And you do see improvements in the lid edema, in the telangiectasias, in the expressibility, in the corneal staining, in the tear breakup time,
Right.
in the symptom index, across the board. So I call this my hero maneuver, right? When I'm talking about my dry eye patients, this is my hero move. I lead with this early and often. It's fast, it's effective, it's efficient, and it's healthy for the practice. It's good medicine. Yeah.
I think one of the things that I found I thought would be challenging is I never thought that patients would enjoy or consider something what people would think is intense because they think of lasers. I was like, but I realized they actually prefer non-pharmaceutical, non-surgical ways to actually improve their eye health. And that was something that I didn't realize was important to patients. I thought the other way, but after really explaining it to patients, I saw that really mattered to them to be able to find a way to treat their eyes effectively and non-surgical or non-pharmaceutical matter.
Oh, I love that. And I think it's an idea that's really prominent in the Gen Zers, the younger generations for sure, about being proactive with their health, doing things drug-free, drop-free, medication-free, and that's what you get with this system. Talk to me a little bit about computer use and young people showing up with really severe ocular surface disease and meibomian gland dysfunction. Talk to me a little bit about that aspect of helping a person function well, reading speed, at work, all those things, and then how the aesthetic benefit, the look better part, in addition to the feel better part, ties all together for you.
Yeah. So I think first, looking and seeing better will also help you feel overall better.
Have you noticed that too? Like sometimes a full
Yes.
line of vision. Have you noticed changes in refraction as well?
Yeah.
Yeah.
I've stopped
in
infractions
topography.
completely just to say we're not going to finish because I don't want to make a pair of glasses that you're not going to see well a few weeks later just because of the fluctuating vision. And so
Smart. Yes, changes in the axis of astigmatism, changes in the refraction in a good way, right? And that's so smart because that lens regrind is money out of your pocket, right? We usually comp those, so that's super awesome as well. Look better, feel better, integrated health, wellness, early identification, advanced care for the advanced patient. What's not to love?
I think the aesthetic component, like you mentioned, they don't say it. You can see their eyes, their head turning. They're like, wait, okay, so I can come here, get treated, look a little bit younger, get some skin rejuvenation, and improve my dryness. Yeah. This is both like aesthetics and medical at the same time. Sign me up.
Yep.
And it's why would they not do that instead of going to a cosmetic place where they just get their skin but not their dry eyes treated?
Right, and that's a different protocol, right? So a photofacial is not the same as what we're doing here. This is optimized for control of the abnormal blood vessels, for the inflammatory burden, and it's targeted and specific to dry eye associated with MGD. Nice. And so as you move forward, now that you've got all this amazing experience, and you're doing great, that's exactly where I would anticipate the use to be, and congratulations on getting there so quickly. You're probably close to paying it off, yeah? Amazing. And over how many months? 4, 6?
3 months so far.
Amazing. Okay, amazing. And then walk me through what you think the future growth potential of this is in your practice.
I think it's at a point where we may consider having a few days blocked where it's just focused on IPL. And I think that it is something that really draws patients in. And I think the biggest fear of owning a practice, mind you, I opened during the pandemic.
Me too.
Yeah. So, it was really intimidating. And one of the biggest purchases is the OptiLight for me. And it was one of the, easiest ways to sort of get your return on the investment. And I think that going forward, it can only build from there. I think for us, it's just taking that leap forward and just believing that this is possible. I think a lot of patients are looking for something. They're looking for a change. And if you are able to be the first practice to offer this to them, they do come and find you.
Oh, that's fantastic to hear. I love this idea of early identification, advanced care, integration into a busy practice, growth potential, practice differentiation, and looking down the road when patients get ready for cataract surgery. Imagine a world where every pre-op cataract patient, and shows up with a cornea that's pristine.
Or LASIK.
And LASIK too, or a multifocal contact lens. Imagine a world someday. We're going to get there.
We will.
One treatment at a time. Awesome. Anything else you want to add?
No, I wanted to be able to share my experience coming from a completely different sort of practice that perhaps maybe other doctors are, but we kind of are at the same place. We're trying to help patients see better, feel better, improve their dryness, and there's an innovative, great method that we can sort of take into our own hands and make it our own and really help patients. And I think that is amazing to be able to do that and to not be afraid to sort of take that step to try something new.
Yes. Oh, I love it so much. Congratulations for all your successes.
Thank
And you're killing it out there, and I'm so proud of you, and I can't wait to celebrate your other successes. She's going to come out to Seattle and visit, and I definitely want to come out and see her place as well. Oh, you know what I wanted to share? One more thing is this idea of opening during the pandemic in a brand new business model. Terrifying. I did the exact same thing, but I've always joked that if my clinic were to burn down to the ground, I can start again with two things: a slit lamp and this device. That's all I need to get started again. And indeed, that's what I did in June 5th of 2020. Wow. It's absolutely amazing. Wow. Yeah.
Congrats. I definitely can't wait to come visit you too.
It's going to be fun. Seattle's cool. So yeah, I think that sort of wraps it up for the Q&A. You have some booth time coming up, so you can share even more practical pearls with our colleagues.
Yes.
When is your booth
time?
time?
What time is my booth time?
That's okay. It's on the little registration thing while they look it up. I think I've got all afternoon here today, so I'm happy to share best practices, some advanced maneuvers, and then just the basics of the system as well. And I think I've got another spot tomorrow afternoon. So
if anyone has questions for me too, just check on Luminus's website or Instagram page, or check with Larnie, and I'm happy to discuss any questions too.
And follow Dr. Jen and Juice on Instagram. She's amazing. I'm Dry Eye Master on Instagram. I would love to see you there and chat with you there. I've got all kinds of really great cases using this system up there for everybody.
Thank you.
Thank you so much.
I shouted for joy.
You're changing people's lives by using the energy that light brings.
Within a month of getting this device, I was already fully booked. I was seeing 2 patients a day in the beginning, and now a month in, I'm already getting 4 patients a day, and it can only grow from here.
Adding the OptiLight was one of the best decisions I ever made. Today, we're doing 24 to 40 procedures a week. The return on investment has been incredible. It's the gift that keeps on giving.